Okay, in this last section, what we're going to talk about is the human female reproductive cycle. And it's sometimes referred to as the menstrual cycle, and it can be broken into two phases. You have the ovarian phase, or the ovarian cycle, and then you have the uterine phase, or the uterine cycle. Within the ovaries, we have these structures that we've been talking about called the corpus luteum, and their main job is to secrete additional progesterone and estrogen that help maintain the uterine lining during pregnancy. And so there's really kind of 8 to 10 main stages that we can break this whole thing into. And of course, the first part begins with the release of gonadotropin releasing hormone from the hypothalamus. And then this stimulates the anterior pituitary to release FSH and LH. And the FSH is going to, and the LH really, are going to be responsible for the growth of the follicles, or the stimulation of the follicles, and then ultimately the release of the egg. So when the follicles start to grow, they start making estrogen, and then this is where you have several kind of follicles that begin to grow, and then only one is going to mature and give rise to an oocyte. You know, two do, then you get a set of twins, but generally speaking, you only have the release of one egg. And as these estrogen levels kind of rise sharply, as you look kind of right here, where are we? Find the spot on the thing here. When you look right in here, as these estrogen levels begin to rise really high, what these are going to do is they're going to cause the LH and the FSH levels, as you look up here, they're going to cause those to rise as well. And it's more or less a positive feedback mechanism, whereas the high levels of estrogen stimulate the release of more gonadotropin releasing hormone, which stimulates the release of more LH and FSH and so on and so forth. And then that's what is going to contribute to this LH surge that's essentially going to induce that final phase of maturation of the egg, or the follicle, and then the release of the egg. Okay, so this large bulge that kind of is forming, and we can find it right in here, as this thing is beginning to mature, eventually it's going to be released with this LH surge. And you can see how this shortly thereafter that LH surge occurs, that's where you get the release of this egg, and that's that, of course, secondary oocyte we talked about in the last segment there, where it's now frozen in metaphase 2 of meiosis 2, and it's waiting for fertilization to occur. Okay, so during this luteal phase now, this LH is going to stimulate the formation of that follicular tissue into what's known as the corpus luteum, or a yellow body. So if we look here, you can see this corpus luteum, this glandular type of a structure, and it's going to continually be stimulated by this luteinizing hormone, and it's going to continue to release estrogen and progesterone. And you can see this estrogen and progesterone here that are being released. They're having an effect on the uterine lining down here, causing it to further thicken and get ready for implantation of an egg if it should get fertilized. Okay, so as these things continue to rise too, you can see here you've got this combined effect of this estrogen and progesterone level being high. It's going to have kind of some feedback on this hypothalamus, and it's going to prevent the release of more LH and FSH, because we don't want to start this process over in case pregnancy does occur, because we don't want another set of follicles to get stimulated. We don't want the release of another egg a month after the first one was released, because then in that case you'd have two pregnancies a month apart, and that would be no good. So the combined effect of the high levels of estrogen and progesterone have a negative effect on the release of GnRH at the hypothalamus, preventing the LH and the FSH from being released. And in addition, the high levels of estrogen and progesterone promote the thickening and continued maintenance of the uterine lining, okay, for that implantation of the possible egg. Now, at the end of the luteal phase, if the egg has not been fertilized, then what happens is the corpus luteum starts to disintegrate. You can see here it's starting to break down. The estrogen and progesterone levels here, of course, are going to drop, and as a result of them dropping, we're going to enter this phase right here, which is menstruation, which is where the uterine lining gets sloughed off because pregnancy didn't occur, and then the cycle is repeating itself. And those estrogen and progesterone levels that are dropping are kind of taking the brakes off, so to speak, the GnRH release. So now, as those drop, the hypothalamus will release GnRH, which will cause the anterior pituitary to release the estrogen and progesterone, and that's what's going to cause this cycle to repeat itself. Okay, so one of the things that we've been saying is the estrogen progesterone have a big effect on the uterine lining. They cause the endometrium to thicken, and basically it becomes full of arteries and glandular types of tissue. The proliferative phase basically means that's the growth phase of the uterine lining, and what it's doing is it's preparing for the implantation of a fertilized egg should that event occur. Okay, so now we said that after ovulation, that estrogen progesterone continue supporting that corpus luteum, continue to stimulate it so that it can maintain the endometrial lining. And what we were also saying too with this entire thing is what we're doing is we're coordinating this luteal phase with this secretory phase in terms of the glands that are in this endometrium are secreting a fluid that's going to help support and maintain that embryo as it's implanting itself in this uterine lining. Now, if we don't get pregnant, if fertilization doesn't occur, then the ovarian hormone levels are going to drop, and that quick drop is what's going to trigger the menstrual flow phase. And the first day of menstruation is the first day of the ovarian cycle. And during this process, of course, we're shedding the endometrial lining, and we're starting this entire process over. And one of the things that we mentioned in class 2 is that if the fertilization does occur, then the embryo is going to secrete human chorionic gonadotropin, HCG. And that HCG is going to stimulate the corpus luteum to continue to produce high levels of estrogen and progesterone. And those high levels of estrogen and progesterone, we said, of course, are going to have an impact by supporting the continued growth and proliferation of the endometrial lining, as well as it's going to keep the brakes on the GnRH a level in the hypothalamus, keeping that from being released, thereby preventing the LH and FSH release, and of course preventing a pregnancy a month apart. Okay, so those are some of the things that we talked about in class, and as is always the case, if you have any questions, if there's anything in here that didn't make any sense, make sure that you write those questions down in any of the 3 parts, and then make sure you ask in class, and we'll be sure to go over them. Okay, so we'll talk to you soon.